Okay, so now we're going to go through some ear exams, and then that's going to be followed with some neck range of motions. And I just wanted to leave that a little bit to the last because that might cause some exacerbations.
Okay.
Okay, so I'm going to start off with the whisper test. Okay, I want you to cover one side of your ears, and I want you to repeat the word after me. Okay?
Sandwich.
Okay, and then the other side.
Breath.
Okay. Alright, perfect. Alright, so we're going to be moving on to the Weber test. So I'm going to be placing this tuning fork on the top of the vertex of your head, and I want you to tell me if you can hear the sound louder in one ear compared to the other, or if you don't hear the sound at all, or if you hear it equally on both sides.
Okay.
Okay?
Equally on both sides.
Okay. Alright, so now I'm just gonna do the Renee. So I'm gonna be placing the tuning fork on your mastoid process, and then let me know once you stop hearing the sound, and then I'm gonna be moving it closer to your ear, and then again, let me know when you stop hearing it.
Okay.
You can still hear it?
Still hear a little bit. Okay, it stopped. Hear it. It stopped.
Perfect. Alright, so now with the other ear.
Okay, stop doing it. Hear it. It stopped.
Perfect. Okay, so I'm just going to look at your external ear, okay?
Okay.
Let me know if you feel any pain or tenderness. Okay, so that's negative for otitis externa. Any pain?
No.
Okay. Alright, so also negative on that side and no sign of mastoiditis.
Okay.
Okay, Semide. So we're gonna do an otoscopy exam. Is that okay with you?
Right.
So I see your tympanic membrane. I don't see any effusion or bulging. It doesn't appear red. I see the umbo and the other bony landmarks. And I also see the pars flaccida and the pars tensa. No effusion.
Yeah, I haven't had any ear pain with a sore throat, so.
Okay, that's good. Alright, so I'll just check the opposite ear. Alright, so I don't see any cerumen that's covering the external meatus, and I can see the tympanic membrane clearly. There's no erythema, no swelling. I see the bony landmarks, the umbo, again with the pars flaccida and the pars tensa. So there's no sign of otitis media. Okay. Alright, so I'm just gonna get you to follow my directions in terms of moving your neck.
Okay.
Okay, so I want you to bring your chin to your chest for me. As much as you
That
can.
kind of hurts a little bit.
Okay, you can stop right there. Perfect. And I want you to just look up at the ceiling as far back as you can.
That hurts.
Okay, you can stop right there. And then I want you to just move your neck so that you're looking over your right shoulder.
It hurts.
Hurts? Okay, you can stop there. And then just do it on your other shoulder.
It hurts about there.
Okay. Okay. And I want you to bring your ear to your shoulder.
It hurts.
Okay. Alright. And then your other side too.
It hurts.
Is there a side that feels worse?
It's always the side that feels worse.
Okay, so your left side.
Mm-hmm. I feel
Okay.
the pain always on the left side.
Okay. Okay, so this will be better if I have you laying on the table. So
Okay.
I'll set up the bed for you.
Okay.
Okay, Semide, so I'm just gonna be moving your neck for you. Let me know once it gets too painful and I can just stop.
Okay. Just feels a little uncomfortable, but it's not really painful.
Okay.
That's kind of painful there.
Okay. Yeah, that's your left side.
Yeah, it feels painful on the left again. That one is not too bad. Oh, that one doesn't feel good.
Okay, and then in terms of extension, it'd be better if I have you laying on your belly.
Okay. Like this?
Yeah. Yeah, you can do that. Okay. Painful?
That seems okay.
Okay. Okay. I want you to tell me once you feel pain, okay?
Okay.
You can flex your knee. Yeah, let me do all the motions for you.
Okay. No pain. No pain.
Okay, so we've both done the legs, and that's a negative for the Kernig's test, which would indicate meningitis.
Okay.
And since I flexed your neck, that would have been the Brudzinski, and that was negative, and that's also testing for meningitis. Okay, Semide, we're just going to do the posterior chest exam.
Okay.
I'm just gonna untie the knots on your gown. Okay, I'm just gonna start off with inspection of the skin. I don't see any nodules, any redness, any scarring, no vesicles. I see a few nevi, but nothing that looks concerning, of different colors. Let me know if you feel any pain or tenderness, okay?
Okay.
Any pain?
No.
Okay. Alright, so I'm gonna do a few methods here. So we're gonna start off with whispered pectoral soliloquy. So I want you to say the words 1, 2, 3, and I'm just gonna be placing my stethoscope on your back.
Okay.
And so every time you feel the stethoscope move around, just repeat the words 1, 2, 3, okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. No signs of consolidation. Now with tactile firmness, I'm going to be putting the ulnar edge of my hands on your back, and I just want you to say E.
Okay.
Okay?
E, 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 E.
Okay, I didn't feel any increased abnormal vibrations, so no signs of consolidation as in pneumonia. Okay, now I'm going to be listening to your normal breath sounds, so just take a deep breath in and out for me.
Okay.
Alright, all breath sounds were vesicular. I didn't hear any bronchi or any sounds of crackles, which could indicate fluid in the lungs, which is not the case for you.
Okay.
Okay, now I'm just going to visualize your thoracic expansion just to see if both sides are equal. So I'm just going to put my hands around your back.
Okay.
Okay, take a deep breath in for me. Out. One more. Perfect. So everything is symmetrical.
Great, thank you.
Alright, so Semide, I'm just going to unbutton your gown just on the back side so I can just expose your shoulders and your anterior chest.
Okay.
Okay, so I'm just gonna get you to just protect your breast tissue for me. Let me know if you feel any pain.
Okay.
Perfect. Okay. Okay, so again, if you feel the stethoscope on your body, just take a deep breath in and out for me.
Okay.
Okay, so starting just with in through your nose and out through your mouth. Okay, you can breathe normally. Okay. I don't hear any crackles or rhonchi. Your breath sounds do feel and sound a bit weak. Is that normal for you?
Yeah, I do have weak lungs.
Okay.
I've been told.
Okay. So that could also explain why you're prone to more infections and you have a poor immune system, especially when it comes to cold weather or when the seasons are changing. So now that we have spring coming in, there are a lot of pollen in the air, which could also be the cause of some of your symptoms. Okay, so we're just gonna go ahead with the heart exam now, okay? So I'm just gonna first do some landmarking. Is it okay if I just bunch this up?
Yeah.
Okay, now I'm just gonna get you to just protect your breasts and just lift them up so I can listen to the mitral area. Thank you. You have a strong heart.
Good.
So I didn't hear any regurgitation or any skipped beats that could indicate arrhythmia. I heard both the S1 and the S2 sounds. I didn't hear any additional adventitious sounds like clicking, like a holostolic click. I didn't hear that. Everything seems normal with your heart. Okay, Semide, we've done all the physical exams that I wanted to do with you. So far I'm thinking that what's going on with you on the neck is probably just some muscle strain from the massage. It might have been a little bit too much pressure, or it might have been too vigorous. And so your neck, in terms of treatment, you need a warm bath or just putting some heat applications just on the neck.
Okay.
So if you have anything at home, like a heating pad, that could be really useful. So just applying that on the back side, on the side, and just making sure that you have it on for 15 minutes or less, whatever feels comfortable, but just don't sleep with it on overnight.
Okay, sounds good.
Yeah. And in terms of boosting your immune system, I think what's best for you is a tea. So for tea, I'm thinking echinacea and licorice tea. So sipping that 2 times a day or 3, just a cup. So you just put the tea bag in 1 cup and let it steep for around a few minutes and then just sip through it.
Okay.
And I also want to give you a tincture. Okay, so in terms of the tincture, I want to give you andrographis, astragalus, and eleutherococcus. So these are very effective adaptogenic immunomodulator herbs that will help stimulate your immune system to help protect you throughout the season, as well as helping you become resilient to any type of physical or emotional stress. And I want you to do 1 teaspoon BID, so twice a day, just for 2 weeks.
Okay.
Okay, and I'll give you enough to last then.
So where would I get that?
Yeah, so good question. So you can get the tea, you can get the tincture at the botanical dispensary. They will be able to help you and set that up for you.
Okay. What about in terms of diet and lifestyle? Is there anything I can do to help improve my immune system?
Yeah, that's a really good question. So number one, I want you to prioritize your sleep. So make sure that you sleep early. I would say maybe definitely before midnight.
Okay.
Aim for 10 p.m. or 11 if you need to, and try to get at least 8 hours.
Okay.
Especially when you're sick, your body will tell you that you need more sleep, so just try to listen to what your body tells you. In terms of food, I want you to focus on very nourishing foods and warm foods. So broths, soups are really helpful and very nourishing, especially when you're sick, and just focusing on lots of vegetables, lots of mushrooms. Mushrooms are really great in soup. They're tasty, but they're also helpful for the immune system.
Okay.
Yeah, and also just drink plenty of water throughout the day, and if you can, make sure that they're warm liquids.
Okay. I'll do my best.
Yeah.
Thank you so much.
Yeah, you're welcome. Alright, so this is your prescription. I want you to take this to the dispensary.
Okay, sounds good.
Alright, well, if you have any questions, feel free to call me or email me at the clinic, and if things get worse or anything like that, just give me a call and we can set up a next appointment.
Okay, sounds good. Thank you so much.
Alright, see you later.
Bye.